about functional medicine is that patient, it's mostly the person to control this pace. So you are your own doctor, you are your own health advisor. So you are very actively involved and participate. So and then you help your doctor to monitor the process, and you are voluntarily join this program. So it's a lot of the patient activity involved instead of the conventional medicine that it's all controlled by doctor. Doctor give you prescription, you go to pharmacy, and then doctor tell you how much you take, how many times you take, what time take. But for the functional medicine, because it's more about your lifestyle, it's the if you understand more, you are motive more, and then you will get much better results. And we said if the diet is right, the medication is no use. If the diet is wrong and the medication it's no needed. No, sorry. If diet is right, the medication no needed. If diet is wrong, medication no use. So even you have best medical system or best coverage of insurance you have, but nobody can save you. Your doctor cannot save you. The medication cannot save you. So it's really you have to start from early age, and then do all the preventive, do the homework by yourself, and then so in that case you really don't need to go to the doctor to get a prescription. Many you go to doctor because you need doctor help you to monitor your blood work and your progress, but it's not to go to doctor get prescription for the medication. So that's a totally different concept. So the bioidentical hormone treatment is so popular now because the hormone imbalance it's a lot of the chronic problem cause a lot of chronic problems. Also it's the main cause for people get sick. And the many years ago, the American and also Europe doctors and the patients, they are doing the hormone replacement therapy, and that time it's from the pharmaceutical company. It's modified. The molecule of the medication is modified different from the hormone our body produced in order to get a patent and in order to sell to the prescribed for patients. And for example, some are from the pregnant horse urine, and that is not from the human, and then so the problem. And that time they did help a lot of women to keep young and keep some energy and skin tone and keep more the looks young, but the problem is that after 10 years or 15 years follow up, and the people get the replacement hormones replacement therapy compared to the non-therapy group, and the hormone replacement therapy group, the ladies get more heart disease and also some cancers, and also the bone density problems, arthritis, something like that. So then they stop the treatment. They stop the treatment because that's caused a lot of harm. So that's also one of the reasons a lot of conventional doctor, because they heard the news, they know something about that, but they never go really go look into that. And then they anything talk about hormone, they just say no, they don't want to touch it, they don't want to prescribe to the patient. But in the some small group of doctors and the patients, they don't give up, and then they just said there has to be something from nature. It's more close to our bodies, the hormone that can help. So that's how the bioidentical hormone replacement therapy come out. So basically, this is the bioidentical hormone. It's from compounding pharmacy. It's not from pharmaceutical company. The compounding pharmacy and then the raw material, actually it's extracted from soy and also the Mexico yam. It's basically from the food, and then they did some modification in the lab to make it exactly the same molecular structure as our body produced hormone. So that's why we call it bioidentical hormone. So this one, because it's the same, exactly the same structure as our body hormone, so there's not much side effect. It's just a matter of whether you get enough or you get too much, whether you get too much or you not get enough, or maybe the ratio you use is not correct for your level. So this is the functional medicine doctors, they prescribed to their, it's by prescription, some are not, especially the testosterone, it has to by prescription, it's controlled substance. But the progesterone you can buy sometimes over the counter, and then estrogen, some maybe you can buy over the counter. But the best one, the very safe one, it's from compounding pharmacy. So it's better to see the functional doctor. They have special training about the bioidentical hormone. They know what looking for, what's the level you are, what kind of test you need done, what's the ratio, and so they can help you the best. And but not every doctors they get this same training. So when you want to get the hormone treatments, especially the bioidentical hormone treatment done, better ask the doctor who has the training. It may not be the specialty or the fellowship, board certified functional medical doctor, but at least should be have some like a certificate. They attend the seminars. They have the same credits for those special treatments. So and also have certain experience for hands-on treat patient experience. It's preferred because this it's the hands-on experience can really help for the diagnosis and the treatment, find the right dosage for you. And it's also about the adrenal and also the thyroids. The thyroid for the bioidentical hormone, they don't use the pharmaceutical companies like Synthroid, that's only T4. Instead, the bioidentical hormone doctors for thyroid, they give you the mostly the nature soid or WP soid. Those are the from the pig thyroid extraction. They are not only have T4, they have T4, T3 combined, and the very good ratio. because T4 is inactive form of the thyroid hormone. If you only give T4, but if your liver function is not good, so they convert to the active form of T4, T3 might be not efficiency or even maybe go to the, instead of convert to free T3, they may be converted to reverse T3. That will be even harm for your body. So that's very important. So the functional medicine doctor, they know how to check your thyroid panel, not only TSH, total T4, total T3. They also looking for the free T4, free T3, and reverse T3, and the ratio of the free T3 and the reverse T3 can be some indication for the thyroid function. And they also looking for the antibody, the TG antibody, and then TGB antibody, to make sure you don't have autoimmune disease like Hashimoto. Because if you have autoimmune disease, the treatment can be a little bit different. So those things, it really depends on experience and the education, the knowledge. It has to have special training to get this, because this is not conventional medical school or conventional residents or conventional doctors get this treatment. And this functional medicine, it's a front edge of the new medicine practice. It's the future medicine, and there are more and more doctors start open their minds, start get involved, start curious about it, and start to learning this and get some information. That's the good, but we still need to push more and more doctors. So patients, if you are interested about this, you want to get treatment from this, and you need to talk to your doctor to push them to get more involved, because at least they are doctors. It's much easier for them to learn and to apply to their patients, because it's for the bioidentical hormone part, it's a little bit difficult for the ordinary people. It has to be by doctor. So that is something. But on the other hand, change lifestyle, the eating habits, some supplements, that part, exercise, sleeping hygiene, and stress management, those parts you can do by yourself, but it's always good if you have doctor give you, if you have some nutritionist, and functional medicine doctor to give you directions, so you can have more, you can get the shortcut instead of play around, fooling around. So that is very helpful. Then for the adrenal, like if we see the whole body, and we can see the adrenal, it's the very important, it's the first system or something we are going to looking for, because adrenal dysfunction or adrenal burned out, it can be affect your thyroid, can be affect your other hormones. It's root of cause of a lot of problems. So adrenal, the blood test or saliva testing for the adrenal panel, it's a very crucial. We need to, that's also partial of the functional medicine bioidentical hormone, because adrenal, it's the place produce some of our hormones. So that is also the part most conventional doctor don't want to touch. So basically, the functional medicine doctors, they do mostly two parts: the lifestyle coaching and the bioidentical hormone. They look at your body as the whole, and then they analyze. They do step by step, and to help you go through the recover, and then change your health in the good way. And another thing I think we have to emphasize the very much is about the GI system. So what you eat, what you put on your mouth, it's very important. But also the liver. The liver is a partial of our organ, the GI organ. It's the liver is very, very important for our digest. The liver produce a lot of enzymes and proteins. Our hormones, process our a lot of the important hormones, enzymes. So if your liver been damaged, then you have big problem. So the first thing, a foremost thing before we do everything is that we want detox your liver. So make sure the liver is not overloaded. Its liver is clean. It's functioning correctly, and then you start to put on the supplements one by one. It's not everything done at the same time. Don't to be greedy, because even the supplements, they might have some side effect. They might cross react, and also they might affect the medication. So you are ongoing taking. So that's very important. Don't think a supplement is safe. It can be safe. It's also can be some problems. So we don't overdo it. It's what I did for myself is that. Before I do anything, I do detox my liver. So make sure my liver function, everything works fine, and then I start to eat one by one the supplements, probably two weeks apart. So make sure my body it's take it, and then no side effect, and then I put another one, and so gradually it's no harsh, but you have to make sure they're safe. Your body, its tolerance, because and also gradually reduce the dose, and then eventually tamping down, stop the medication. But you have